Moving on, data available to UNICEF shows that a lot more teenagers, particularly girls, are increasingly contracting HIV and AIDS infections in West and Central Africa as compared to other parts of the world. Speaking to the Global AIDS Monitoring and UNAIDS 2022 report, UNICEF Chief of Health Alexandre Bonne says the situation could be attributable to many factors, including a myriad of challenges confronting the SAP region. He spoke to Joy News' Emefa Tiamwa Eli in an interview in Lomé. There's more in the following report.
Sharing details of the data with members of the African Media Network for the Promotion of Health and Environment, REMAPSEN, at a workshop in Lomé, UNICEF's Chief of Health in Africa, Alexandre Bonne, said despite advances in recent years, particularly in reducing HIV transmission from mother to child, attention and support for children and adolescents living with HIV remains insufficient. Alexandre believes this is among the myriad of other factors aggravating the prevalence of cases, particularly among adolescent girls in Africa. He said girls are at a greater risk of contracting new infections compared to boys.
In some countries where the incidence and the prevalence of HIV is on the rise, we have noticed that, unfortunately, the majority of newly infected people were among adolescents, and particularly adolescent girls. And as we showed it on the graphic, the risk of adolescent girls to contract HIV is pretty much 6 times higher than the equivalent of age of the male adolescent. And that is probably related to many things and many circumstances or behaviors, or either social, related to poverty, perhaps related to the circumstances where these adolescents live.
Also among the regional challenges compounding the threat to adolescent health include limited engagement of community health workers in HIV and AIDS service delivery, as well as low availability of adolescent and youth-friendly health services in countries recording higher figures. According to the Global AIDS Monitoring and UNAIDS 2022 estimates, West and Central Africa is one of the regions in the world where children and adolescents are most affected by HIV, putting them just behind East and Southern Africa.
We know that girls in general are much more sensitive to sexual transmitted infection, including HIV, than boys. The intergenerational sex is also one of the contributing factors. When a young adolescent or an adolescent girl gets into sexual intercourses with older men, there's a higher risk of transmission as well of sexually transmitted infections, including HIV.
According to the report, prevention of mother-to-child transmission has remained at 65% coverage on the region since 2017. 7 out of 10 children don't have access to HIV treatment in West and Central Africa. Pediatric treatment coverage is at a low 35% compared to 73% for adults. Also, there's been only 25% coverage for early childhood diagnosis, with 3 out of 10 children born to HIV-positive mothers tested before their first 2 months of life. Regarding early diagnosis of HIV in infants, Ghana is among 8 countries to achieve above regional average of 25%, well below the target of 95% in the continent. In a clarion call to action, UNICEF enjoins all and sundry to accelerate the pace towards an AIDS-free generation in West and Southern Africa. The Children-Centered Humanitarian Organization believes eradicating AIDS starts with children. Each country must do everything possible to create a world in which children and adolescents are assured of getting the support they need to fight HIV and AIDS, so we can deliver on our collective promise to enable an AIDS-free generation by 2030. Emefa Tiamwa Eli's report for Joy News, Lomé.
Director General of the Ghana AIDS Commission, Dr. Chiroma Atuahene, says the country risks losing its human resources to HIV/AIDS if nothing is done about the increasing spate of the HIV infections. Dr. Atuahene was reacting to the Global AIDS Monitoring and UNAIDS 2022 report, which says girls are 6 times at risk of getting infected with HIV/AIDS virus.
Receptive sex is generally riskier than insertive sex. So whether it is vaginal or anal sex, the receptive partner is more at risk to infection than the insertive partner. And this is because they raise greater mucous area in the woman which is exposed to HIV during penile vaginal intercourse. And if there should be any breach or tear of the vaginal mucosa or anal mucosa, which is relatively thin, there definitely will be an increased risk or likelihood of HIV infection in the woman or the receptive partner if they happen to be a man. And so if this occurs, then we see that is one of the risk factors. Then if there should be untreated sexually transmitted disease, and of course in women, it takes a long time for them to see whether they have any symptoms of sexually transmitted infection. And so if it is untreated for a long time, especially the untreated one, it increases the risk of the woman or the girl becoming infected if exposed to HIV. My advice to the young people is that it's not everything we see on the internet that is wholesome for us, that we should also experiment or practice. We should take our lives into our own hands and ensure that we live healthy lives and productive lives. And so sexual activity, getting into the scale of the services that we need to provide. For example, if we do not have adequate funding to provide the combination prevention services to people who need them, then it becomes a challenge. Number 2 is that we have, because of stigma and discrimination associated with HIV, and of course, as we are talking about young people, when it comes to HIV and reproductive health in general, there is some stigma related to young people because we expect that they should not be sexually active. And if they are sexually active and having unprotected sex, getting pregnant, and also getting sexually infected infections, sexually transmitted infections like HIV and others, then we tend to stigmatize them both in the community and in the home, and also the health facility. And this is an area that we all have to work together to ensure that we do not stigmatize young people, especially in the health facility.
Medical Director of the Upper West Regional Hospital, Dr. Robert Amishia, has disclosed that though the hospital have started the operations 4 years ago without the needed seed capital, it has been able to work itself out of some of the teething challenges and is best placed to serve the people. Speaking at an event, an award ceremony for 60 staff of the hospital and other individuals who have contributed to the positive development of the hospital since its inception, he noted that the biggest strength which the hospital is leveraging on is the quality of their equipment and staff. Joy News' Upper West Regional Correspondent Rafiq Salam reports from WA.
Though it was commissioned in August 2019, the Upper West Regional Hospital opened its doors to the public 5 clear months before they were able to have access to quality healthcare services at the facility. The hospital started with a seed capital and was therefore expected to take care of only outpatients. With the improvisation and ingenuity of the management and the zeal of the catered staff of the hospital, they held the bull by the horns, worked above themselves to ensuring that the objective of the government in providing a state-of-the-art 160-bed hospital for the region and beyond is fully realized. Despite the challenges, Medical Director of the Upper West Regional Hospital, Dr. Robert Amesia, opined that the biggest strength of the hospital is the quality equipment and the people manning them. Hence, the need to award them in order to motivate them to increase their output.
We have a lot of strengths in this hospital, which we are leveraging on. And our strength is that the hospital is well equipped. It will interest you to know that we have some of the equipment in this our hospital that are hard to find in other parts of the country. Everyone here is not working for free. All of us working here are paid monthly. I get monthly salary. Ever since I started working, fortunately I've been missed 1 month. But if I go beyond what I'm supposed to do for my salary, there must be a system put in place to say thank you or have a pat at your back for going the extra mile. And we think when you go the extra mile, you put a lot of smiles on the faces of people.
Our Power Soldier Minister, Dr. Hafiz Bin Sali, commended health workers in the region for their commitment to their work, attributing it to the leadership style of Dr. Damien Powiri and Dr. Robert Amesia.
Dr. Damien took over as Regional Director of Ghana Health Service. I have seen a tremendous change in the health sector. We have seen many more people come as doctors. We have seen nurses come to the region. We have seen many midwives accept postings to the Upper West region. And the story is not the same. It's not different when it comes to Dr. Robert.
Our Power Soldier Director of Health Services, Dr. Damien Powiri, on his part, is optimistic that despite the initial challenges encountered, the hospital has overcome many of them and is fulfilling its mandate.
Identify critical staff, add to the hospital. 4 years down, I can only look back with pride to say that our hospital is achieving the intended purpose.
In all, 60 staff of the hospital and other individuals were honored by the hospital for significant roles played in the development of the facility. Notable among them is Upper West Region Minister Dr. Hafiz Bin Sali, Managing Director of USUA Ghana Limited, Alhaji Yusuf Yakubu, President of the Asokoli Traditional Area, Togbe Afede the 14th, and Joy News, Rafik Salam. The overall winner of the awards went to a nurse at the General Surgery Ward, Regan Ajakum, who took home an Apsonic motorbike donated by Kina Farmer. Reporting for Joy News, Rafik Salam. Wow.
Inadequate.